Welcome to Let's Talk About CRPS, a podcast brought to you by MTI directly from Italy. We will talk about the latest news and treatments, patients' experiences, and exclusive interviews of CRPS experts. Don't forget to subscribe to our YouTube channel and visit our website crps-treatment.com. Let's take off! Hi guys, this is your host Emily for this new episode of Let's Talk About CRPS. Today we have the lovely Sandra with us, my favorite patient care coordinator. Hi Sandra.
Hi.
Today we wanted to do a dive deep conversation about CRPS, so just general topics that we touch all day long. We have become some experts on the field. We have seen so many patients over the years.
And we talk to as many every single day. So,
yes, ma'am. So we wanted to just do a conversation in which we touch the main topics regarding CRPS.
Yeah.
So the first one I'd say would be symptoms.
Yeah, the symptoms.
Yeah.
Which is something that we see, as I was saying, the whole day, every single day. What I can say about the symptoms is that they seem to be quite similar between different cases. Of course, you have the main ones, you have some smaller ones, but usually they're quite on the same level. The only thing that we really see the difference would usually be the intensity.
Yeah.
Of course, not everyone is the same, not everyone feels the same, so something can be very painful to some and not as painful to others. That's really the only difference that I have been seeing, in the different cases. But other than that, I would say that we are almost on the same level. What do you think?
Yeah, I think the intensity of the symptoms, and not all the patients have the same symptoms for sure, but the most common ones we find in nearly everyone. The main symptom, of course, being the pain, the burning pain, which is described very often as just a burning sensation, just fire sensation. I've heard electrical shock sensation too, just this feeling of electricity and burning sensation really inside. I've heard someone saying it feels like I have like a million ants inside of my, crawling inside of my legs. Another way I've heard them use to describe the pain is it feels like my bones are being crushed. That's something I hear really often. So of course the pain is the main symptom. We do have another wide range of symptoms.
Oh yeah, if those weren't enough, We have, for example, the skin sensitivity, which is, a major one. There's people you can't even touch, basically. There's people who can't sleep at night due to, sheets touching their feet, touching their hands. So I think it's one of the worst ones, aside from the pain, of course. You can live everyday life by not touching a single thing. Nothing. Another thing that we have seen is, of course, the change in color. You have the affected limb that usually can look, blue, purple. We've seen very unique cases. Yes, super blue, super swollen. Another thing, for example, is the change in nail and hair growth in those areas. The difference is quite big when you compare the two limbs, which is crazy to me. But yeah, those are usually the main ones, and of course, what I was saying, the swelling can vary. There's people who have it a bit less, who have it a bit more. There's people who mask it better. There's people who say, my pain is not as bad on some days, so they can do more. But the symptoms, I would say, are usually almost the same for everyone.
Yeah. Then again, it goes back to the intensity, because I remember Carol, her hand was so big she couldn't even wear her rings anymore. Just her fingers were huge, and you see the difference before and after treatment. It's a picture that you can find on our social media, I think maybe on our website too. It's a pretty famous picture in the company that you can see her hand before the treatment and after. It's just so insane. It's huge and it's very shiny. There's the change of skin,
the texture even,
and it's super shiny and it's swollen and it's red. It's incredible. One other symptoms that is pretty frequent too is the muscle spasm and the muscle atrophy, and just generally loss of range of motion, just anything that is also regarding.
Yeah, I was gonna stop you on the muscle spasms. A lot of people, lately, which is quite weird, have come to us, with these spasms, and they're like, you have, you know, the muscles in their necks, for example, twitching a bit, and they were wondering if it's some kind of, I don't know, people even said, you know, Tourette symptoms, you know, but it's not that, you know. And actually we had one of our physical therapists who was like, no, listen, this is actually, you know, the effect from the pain, like the pain is causing your muscles to twitch. So this kind of, you know, attacks or spasm is actually due to that. So, you know, everyone reacts differently, of course, but you know, there's even new symptoms that we are discovering, let's say, you know, that we haven't, you know, seen before.
But the spasm is one that actually is coming
more
frequently
lately, actually, in the last, I think it's been this year. Before that, I don't think we have had as many.
No, but this year it's just
something to consider, I guess.
So another thing that patients ask us pretty often is who gets CRPS, who gets touched by the condition. You know, because the cause of CRPS is still very uncertain for the whole scientific community. It's not an answer that we can give 100% sure, but that there are some things that we've seen in the last years of our studies and our experience here.
For sure.
Women do represent a bigger percentage than men.
If we like recall our patients, you know,
we have some
the
more
majority.
Women.
We did have some men, of course. But not as many.
We've seen more women for sure. I've seen that 3 to 4 times more often in women than in men. So that's a huge difference for sure. Age-wise, I saw that the peak age of the initial event that brings CRPS is usually between 40 to 70 years old. But again, we have seen a wider range of ages. I think the youngest was 9 and the oldest person so far was 79. So our range is probably just a bit bigger, but the main, you know, the peak age is that. And then I was seeing worldwide about 5.5 person on 100 get diagnosed every year, which that's also a big number.
But I would say that, you know, it would be even bigger if, you know, there wasn't the whole issue with the diagnosis.
With the diagnosis, it stays undiagnosed for quite.
I mean, they call it the rare disease, you know, but actually the numbers are quite big, I would say. Like even in Europe, not only in the US, you know, since that's the majority of people that we treat, but
but in the US only, we're talking 200,000 cases a year.
Which is, you know, more than...
That's a lot.
That's
which is why 90% I think of our patients do come from the
US,
States. So that's more or less, you know, the infos that we have and that the scientific communities have on who gets more touched by CRPS. Another question that we have pretty often is why?
A lot of people come in and, you know, video calls usually, and they're like, why is this happening to me? Is there any kind of, you know, reason why? Did I do something like wrong in my routine or anything like that? And I don't know, analyzing our cases, I would say that usually it comes down to very few things. Like, for example, having the limb, like you break your leg and you have it like immobilized in a cast for, let's say, 4 weeks or more. And that can actually, you know, cause issues. Like it can bring to skin sensitivity, it can lead to losing muscle in that area, mobility and stuff like that.
Circulation problems.
Of course.
If the cast is too straight.
Which happens a lot of times. Like a lot of people do tell us, you know, I had the cast for like a month and a half, which is insane unless you had like a major break, you know. But another thing I would say is some kind of alteration to your immune system, to your nervous system more than anything else. Another factor that I think they have been studying a bit would be the genetic part of it.
Like, they have been trying to understand if there is some genetic explanations.
I mean, since the symptoms are so similar sometimes, is there any factor that actually, you know, leads to this? Like, for example, I don't know, people suffering from arthritis. If there's anything, you know, leading to that, as you know, there's a whole bone factor in it. But it's still, you know, not something that has been, you know, written down as in actually, one of the causes. Other things can be, psychological sometimes, that can happen in children, for example, leading to the symptoms developing.
Yeah.
Even more because we have cases of people just waking up, in the morning and being like, okay, I have this pain and it's weird, we can't explain it, like what's going on. And then they get the CRPS diagnosis without there actually being any starting injury, surgery or anything like that, which is curious, I guess. But I don't know, I think it's something that, to consider, like to study.
Yeah, I've seen in the study that the psychological part of CRP, like a psychological event being the start of CRPS is more frequent in children. I've actually seen one of my first cases was a teenager who didn't have any physical event that caused the CRPS, but it was a psychological event issue, let's say, that started
like trauma, let's say?
Like, yeah.
Okay.
And yeah, I've seen that it was just more frequent in children. But we've seen also cases that came out of spider bites.
Yeah, that was...
Injection shots. Like,
no, it's just, Yeah, but at the end of the day, the most common, cause of CRPS is, a fracture, a sprain, a surgery gone wrong, So those are, I would say, the main reason why this can develop,
Yeah, so a way to kind of prevent, of course, it's not possible to predict or prevent 100%, but a good way of preventing. I saw reading about prevention in general is mobility a lot. If you have a fracture, a sprain, moving.
Yeah, to start right away with physical therapy, like
yeah.
to get it, working again.
And vitamin D, I also saw.
Oh yeah,
vitamin D,
vitamin C as well, and also B12.
These are things that can, help prevent, but of course it's impossible to predict or prevent 100%. But if you do have an injury that is the one that you just said, fracture, sprain, surgery, it's always a good idea to just straight away start with mobility and loads of vitamins for sure. So another huge part of CRPS is of course the diagnosis. We know too well it's very difficult especially for patients in the States, I think. But though, even in Australia, New Zealand, from a lot of patients that we saw, it was so difficult for them to get a diagnosis.
Here CRPS is a rheumatological illness, so what you do usually you go to see a rheumatologist. But in the US, it's not as common from what we see like in the States. What is common there is going to a pain management doctor or going to a neurologist, which isn't wrong in any way, but they might struggle a bit more, I guess, with the diagnosis part.
Yeah, I've seen patients coming with the diagnosis from a neurologist, a rheumatologist, a pain management, even a general practitioner. When coming here for treatment, the patients are followed by a rheumatologist, so I would advise if you have a doubt, the rheumatologist would be a great doctor to go see for a definite diagnosis.
That's what we say to patients usually,
So how do you get a diagnosis?
Usually you just start by ruling out any other possible underlying condition, which is the most important part, you know. Of course the symptoms are not, when they're all together, it's hard to say, it's hard to say that it's another disease usually, but it's good to, rule out anything else. The main, I would say, tests that doctors can do at the beginning would be like an MRI, for example, an X-ray, just to see, of course, if there's any issues with the tissues, with the bones involved, which is important.
Nerve
conduction studies, for example, to see if there's any issues with your nerves. As you know, CRPS type 2, for example, stems from actual nerve, damage. So it's important to see that as well. I mean, CRPS type 2, usually it's a bit harder also to diagnose because you never know really. But those would be the first tests that I would, advise.
And so of course the first step will be rule out any other condition with everything you've said before. So MRI, X-ray, blood work, and any other test needed. And then, of course, to be more specific on the condition, we have the Budapest criteria,
yes, of course,
which were invented in 2004 and are very specific to CRPS. So we've taken the actual criteria with us, just so that we can get more in details.
Yeah, of course.
So why don't you tell us how that works?
So usually, as she was saying, what doctors do is basically these tests just to see how many of these symptoms are actually present in a patient's situation, just to see, of course, how everything is going. Yeah,
so it's divided into different things, which one of them is the symptoms.
Yes.
So things that the patient have felt or seen.
Yes, of course.
And then the signs, which is at the time of the examination, the medical professional have seen.
Yes.
Or can see.
Yeah, and that usually helps, that should be able to help with actually diagnosing it.
So what are the symptoms? There's 4 categories.
Yeah.
What are the categories?
So one of them is a sensory category, the other one is the vasomotor, pseudomotor, and motor category, basically. With the sensory one, we're talking about hyperesthesia, for example, which is the increase in sensitivities we were saying before, like patients are not able to be touched anymore, anything touching them hurts, or a touch that usually it's not supposed to be felt feels like someone hits you with a truck, basically. So that leads to also allodynia, what we call it, which is that sensitivity that I was mentioning. So yeah, everything basically can trigger a flare up or just pain in general, like worse pain than it already is. Other than that was the vasomotor one. So we're talking about the skin change, the color change, which is also a big factor. It's one of the first that you notice, when you see patients, like when they send you pictures, for example, for the evaluation with our doctors, what we see, the first thing that we notice is the change in the color change,
And temperature changes too in that.
Yeah, so a lot of them are like, I feel it, like the limb is, cold, like ice cold, and as people come in, they're like, oh my God, it's on fire. Like, and actually the temperature can be seen. Like, if you put a thermometer next to each limb, you actually see that there's difference between the one that's with CRPS and the other one without it, So it's something that actually can be seen. The other one is the pseudomotor, as I was saying. You have excessive swelling, you have sweating in that area, It's just like that limb is not a part of all the other limbs that you have in this case, like it's completely different. The other one is the motor or trophic one. As it's something that happens. It's like the decrease in motion, for example. Yeah, the range of motion. Of course, that can happen due to not using the limb anymore, which is common when you have pain. Like you don't use it, you use the other one. You compensate with the other one, so of course you lose muscle, you lose motion, and yeah, that's also something that can be seen, I think, even after a couple of months since the onset date of it, I would say,
And then, in the motor category, you also have the spasm that we were talking about, or the tremors.
Yeah, so you also have like the change, as I think I mentioned before, like the change in like hair growth in that area, like nail growth as well, which is a big sign, I would say, of CRPS,
So during the test of the Budapest criteria, the doctor will ask the patient how many of these symptoms he has been experiencing, and at least one symptom in 3 of the 4 categories have to be ticked in the symptom category. And then in the sign category, which is then the thing that can be seen during the examination, it's at least one sign in 2 or more of the categories. So it's the same category, so we have sensory. So we will go and test the hyperalgesia, which was the increased reaction to pain. So a pinprick would be horrible pain when to someone who doesn't have CRPS, it would just be pinprick. And then allodynia to light touch. So that would be the test that they would do physically to understand
how
the symptoms that you currently have. So then vasomotor, so you will see the difference between the temperature in one limb and the other, like you said, with a thermometer. The sweating and the swelling difference, you can see that too on during the examination. And then, like you said, the range of motion that you can also see during examination. So So in between, you know, the symptoms and the signs, having ticked the symptoms and the signs in some of the categories, the doctor would be able to say, okay, following the Budapest criteria test, I will confirm that this patient has CRPS. So that would be, let's say, the more certain way of knowing.
Yeah.
Put this with the fact that you have checked before if it could be any other condition and it wasn't, you usually have a CRPS diagnosis.
I think that would be a good start, like
that
for
would
a lot
be a
of
good
doctors.
start.
Even for doctors who don't really know about it, you know, sometimes patients come in, they're like, our doctor doesn't really know what to do. So what we do is usually we try to, you know, explain a bit the Budapest criteria like this, and then just give them, you know, the list. They can pass it on to the doctors, of course. But this should be, you know, quite helpful, I think.
For anyone listening, just because it happened literally last week, having seen so many patients, we also have, you know, names of the doctors that gave them the diagnosis.
Or, you know,
so if you have a doubt on a CRPS diagnosis and you cannot find a doctor who is aware of the condition, feel free to contact us. We have a wide range of names and in different states and cities.
So you know, just tell us where you're from and we will try to, you know, give you the best possible doctor in your area.
The name of someone who is aware of the condition and can give you a diagnosis, as we know that it's something that is needed if you do want to go through the treatment here in Italy. You will need a diagnosis. So if you have a doubt, you know, feel free to contact us and we can give you names of people that, you know, are aware of the condition. And of course the final, you know, topic of CRPS will definitely be the treatments. We have done Let's Talk About CRPS episode on that, which should be episode 1. So feel free to go and listen to that because it's another big topic.
And I think we actually covered it quite well, so you know.
Yeah, we did. So yeah, feel free to go listen to the first episode. That's all for today. Thank you so much for being with us, Sandra, and we'll see each other on the next episode of Let's Talk About CRPS next week. Bye.